So I come to you, I'm a patient, I'm already on my levothyroxine. I guess my first question to you is like, how do you explain to me, like, why am I here? What are you going to do that's different than my endocrinologist? If you have Hashimoto's, you will love today's guest. Ina Toplier is a board-certified clinical nutritionist with over 19 years of experience in practice. And she has her own podcast called Thyroid Mystery Solved. And she is the founder of Complete Nutrition and Wellness. What I love about how she manages Hashimoto's, we'll talk about it, is she created a really unique program that is super accessible for everyone. It's, whether it's accessible because it's at their own pace, it's accessible because it's affordable. And I love that she took the time to do that because I know how much time that takes. So without further ado, let's jump into today's podcast. So Ina Toplier, thank you so much for being here with us.
It's such a pleasure to be here. Thank you so much for having me.
Amazing. So we're going to talk about Hashimoto's, aren't we, today?
We are.
All right. But before we get to that, so much to dig into, and with so many mutual audience, I'm sure, that are suffering with this. Tell us a little bit about what you do.
Sure. So I am a board certified clinical nutritionist, and I help people to get to the bottom of what is causing their Hashimoto symptoms and really working on balancing the immune system and helping to support their thyroid. In terms of Hashimoto's, a lot of people don't realize that it's really this double kind of pronged thing where Hashimoto's is an autoimmune disease where your body attacks your own thyroid. And so often people are told they have hypothyroidism or slow thyroid. And so they do things to support their thyroid. But and I know get into it much more in terms of the disruption of the health industry and the market, right? But so many providers who are very conventional really don't do anything for that immune system.
Yeah.
Right? So what happens is that you end up chasing your own tail, right? You do stuff to help the thyroid. The immune system then destroys the thyroid more. You do stuff to help the thyroid more. You get more destruction. You help it more destruction. What happens is people end up taking medicine and then increasing their medicine year after year. And oftentimes while they're on medicine, and by the way, there's nothing wrong with medicine. People need it, in terms of thyroid in a lot of cases. But I often hear people say, well, I've been on this medicine, I'm raising my dose, and yet I don't feel any better. And so what I do is I really work with people who have hypothyroidism and Hashimoto's because often they go together. And sometimes people have Hashimoto's and there's no hypothyroidism yet, but it's coming if we don't support it.
Correct.
And so we really look at their body and their thyroid from all angles to make sure we're supporting their thyroid and the immune system so that we can then help them to lose weight and increase their energy to get rid of brain fog and all the things.
Yeah,
it's the wonderful symptoms that come with Hashimoto's.
It's so interesting. I tell people all the time, it's like, because people know what diabetes is, right? Like people know it's a sugar thing, right? And so I always say it's like continuously giving medication for the diabetes, which you need, but never having the conversation about maybe we should stop ingesting all the sugar so we could stop the cause of it. So if you're just taking the thyroid medication, yes, you need it. And in many cases, and you're treating the issue, but you're never really treating the underlying cause. And so you're going to keep giving more medication. That's so true. But I imagine you didn't start off this way, right? You went to nutrition school. I can't imagine you went there saying, I want to learn about Hashimoto's, right?
Correct. Yeah. So I actually worked on Wall Street for 8 years. I schooled for finance, and I worked on a trading desk, and it was a very glamorous job in New York City. However, I was feeling pretty crappy. I was tired. I had terrible skin. I had IBS. I had a lot of hormonal issues. I had constant headaches. I was definitely foggy. I mean, the list of symptoms goes on. And so I did what most people do. I went to my doctor and they were like, there's nothing wrong with you. I went to another doctor. I ended up seeing 4 different primaries who then sent me to a specialist, an endocrinologist, a gastroenterologist, a dermatologist. And then, they all gave me different medicines for different things. Of course, for my skin, I'm here, take some antibiotics, which only gave me a yeast infection, which then I had to go see a gynecologist for. And it's this kind of this disjointed care that I was getting. And then finally, I saw a doctor who said, oh, I know what's wrong. Because before that, it was like, well, we don't know, but take this medicine. Maybe you're depressed. I'm like, no, I'm not depressed. Like, I just don't feel well. Well, maybe, it's because you're depressed. I'm like, no, I'm depressed because I don't feel well. I'm not depressed, initially.
Yes.
And so finally, I saw a doctor who said, I know what's going on. you have Hashimoto's. And I'm like, excellent. Excellent. And they looked at me like, I have 5 heads. Like, why are you happy? And I'm like, well, let's go. Let's do it. Let's fix it. What do we do? What do we do? And they're like, well, your thyroid is fine so far. So
Okay.
we're going to do
We got nothing for you.
so we're going to do nothing. And I'm like, what do you mean? They're like, well, your thyroid isn't being destroyed yet. It's going to be, but it's not yet because it's totally fine.
Totally fine.
So we're just going to wait and see. And eventually, when your immune system does destroy your thyroid, then I'll give you medicine and then you'll be on the medicine farm. But for right now, we do nothing. We watch and see. So it's great.
It's great. It's amazing. It's amazing. And for our audience, what that looks like, this story is just like, I'm so agitated by it that I'm calm from it at this point.
Yes.
But so for our audience, that would be if you're getting your blood work done and your TSH is normal, but you have antibodies. So that is a state where you could tell someone, oh, you have Hashimoto's, but since your TSH is normal, there's nothing we could do about it. And so it's this wait and see approach. And so anyone listening there, I'm imagining that's exactly what happened to you, right? Like,
exactly.
Oh, you know, the antibodies are there, but nothing you could do about it.
Exactly. And of course, back then, I didn't go to school for this yet, so I didn't know the ins and outs, but all they tested was TSH and antibodies. And we could get into that later about the importance of looking at everything, right? But once I dug into it further, there were actually things up. And my TSH was normal in lab, but it was definitely not optimal. So there's a whole bunch of other things that go along with that too.
So then you decided to go to school?
Yeah. So that really made me really angry. And I started to research. And I grew up in a family where we kind of try to do things naturally. I grew up in Lithuania, and so there, like, all the food was organic, and you eat, like, what's available, and it's seasonal. And so I think I was kind of used to some of that and doing things naturally. When we moved to America, though, like, I discovered McDonald's, and I was like, oh, my God, like, why didn't anyone tell me about that? Which didn't help my acne and all the other things that I had. But I think deep down, like my core, I knew that there was something. And I remember this was in 2001. There was an ebook, and this is before social media, right? This is before everyone.
Oh my God, yeah. No one knew about this.
Right. And so there was this ebook that I found, and I wish I remember the author's name because I really would want to thank him. And I can't remember. It was so long ago, but it was like a 200-page ebook that I got for like $5, I think. And it was all about the hormones that are in our food and the pesticides and like a lot of the things that just weren't as mainstream as they are now 25 years later.
Yeah.
And so I started to dig into that. And then I realized, oh, wow, like I have all these silver fillings that I got when I was little. And he was talking about toxins in the liver. And then I realized, oh, wait, like then I have this and look, I'm eating like this. And so it just made me realize, okay, like there are things that I can do. So a lot of it was my own research. And then I actually found a naturopathic physician who was also a clinical nutritionist, and I started seeing him, and he did all of these really cool tests. I did out.
Yes.
But we did organic acids, and we did really in-depth blood work, and we did heavy metal testing, and we did a GI stool test, and we discovered so many things, which was exciting because he said we can actually support that. And oh my gosh, I had everything. So I had mercury, I had high copper, I had parasites, I had really bad candida, I had hormonal imbalance, I had a sensitivity to gluten and dairy and a bunch of other things too. And so as we started to work on it, I didn't go back to school just yet. I was just learning from the test. Like he would interpret the test, and then I would go and research more. What does it mean when you have high copper, and how do you get rid of it, and where does it come from? And he explained it, but there's only so much you can do in our appointment. I wanted to learn more. And that's really what got me to say, wait a minute, I'm learning this already. I want to go to school. To be honest, back then, 25 years ago, it was going back to school for me. It never started as that I'm going to have a print.
Yeah.
I'm going to do all the things that I'm doing. It was like, let me help myself. And then it started with helping friends and helping neighbors.
And then it just happens because it's like once you go in the vortex, you can't unsee it.
Exactly.
So what was it like? I imagine at some point you went to school for nutrition, and then you're talking about this progression. I remember my progression also, where I was like, okay, well, I just dabbled in it. I was learning it from my wife. She was not well. And then I did it a little bit here and there for some patients. And then as the more I got to know, the more I was like, okay, getting the message out was scary for me because I was like, oh,
Mhm.
everyone's gonna think I'm crazy. And like everyone's gonna look at me and like my colleagues gonna think I'm crazy. And it takes, for me at least, there was like some time to develop the bravery to be like, it is what it is. I gotta help people, right? Did you have that moment, or was it just like you were already in a community and was well received?
That is such a good question because I think I did, but to be honest, I think I forgot about it just because
Mm.
over the last, I would say 10 to 15 years, it's just everyone is needing this and wanting this. And I've had a 2-year wait list and it's just been like so crazy. Like there's not enough time to help all of the people. So I think I forgot, but I would say yes, initially. I mean, I think I talked about the nutrition piece even more than like the functional medicine piece back then. But even with the nutrition piece, I do remember because I always explain to people about we want to look at the whole body. It's not just about the thyroid, not just about like your arm or your leg. And I do remember people saying, oh, well, my doctor doesn't say this. And it always would make me feel like, oh, and I'm
Really?
someone who of course, I educate people. That's what I do, right? And I spread the message, but I'm not someone who necessarily likes to preach to someone who's not interested, right?
Oh yeah.
And so,
I don't want to fight the
you know,
fight.
yeah.
I
And so I think like when people would say that, I would kind of weave in, okay, well, have you considered this? And most people would be like, oh, wow, no, I haven't, and then we would go on. And there would be some people back then and be like, yeah, but my doctor doesn't agree, so I'm not going to do it. And I'd be like, well,
all good.
yours that way.
Yeah, no, I definitely am not out here to try to convince anyone of anything. And maybe for you also that can go into the nutrition that's already a bit, I don't want to say alternative because it shouldn't be alternative, but it's already a bit different. Whereas for me, I had to make a decision. Like I was already practicing conventional medicine and I was like, I had to make a turn, and making that turn was really difficult. But you had it for some patients. But you're right. Like if it's okay, it's not for everyone. Go ahead. You keep taking your Synthroid. Like do you, sis? It's okay, right? So, so you started with nutrition, but when did you so niche to thyroid, or were you always niche that way?
So that was probably about 6 years ago. So when I started, I did everything. And people would come to me for all sorts of things. And I think for me, because I've had so many different symptoms, I was a patient. So I understood everyone, right? I had IBS. I understood the people with IBS, growth, gut issues, right? I had so many skin issues. So I understood not just acne, but the eczema and like, dry skin, like all of those things. And then I've had the fatigue, I've had the brain fog, I've had the hormonal balances. So, and what's really neat when you're looking at the body in this holistic way, oftentimes, right, when you fix some of these underlying causes, many things get better. So someone's
Look at that. Things are
like,
connected.
oh, but I feel better energy, right? And I would look at people's thyroid, of course, as well, but it wasn't so much of a specialty with that. But I think the more I learned about my own Hashimoto's and my own hypothyroidism. And, I'm someone who, of course, I like to learn to help everyone else, but I also love to understand things for myself. And I was determined to put this into remission because when I started my practice, I was still dealing with the remnants of the mercury toxicity and the copper and all the things. It took me quite a while, partly because I think I was seeing a couple of different providers and there was just a little bit of like, let's try a little this and a little this. And so it probably, I mean, it's a journey for everyone, right? I would say it took me 10 years to completely get all the metals out of my body. Now that I know exactly what to do, the people that I work with, it takes way less time because I have all these shortcuts, not just from a biochemical perspective, but from a mindset perspective and how we can kind of combine mind, body, spirit together to kind of work and expedite everything. But, it took me a little while to figure it out. When I did, I'm like, wait, like we can have this full like thyroid solution. And then that's when, I started to really niche more.
I love this. Okay, so let's just say I'm somebody that has a thyroid problem. Let's stay with Hashimoto's a thyroid problem because we do know that some women just have hypothyroid just because of age also. So let's stay with Hashimoto's for a moment. So I come to you, I'm a patient, I'm already on my levothyroxine. I guess my first question to you is like, how do you explain to me, like, why am I here? What are you going to do that's different than my endocrinologist?
Yeah. Well, so usually people come to me because they want to put it in remission. They don't want to just manage it. And so what we're doing is, we're not necessarily taking you off your medicine, though there are people who, once their immune system is supported, they may need less medicine.
Correct.
But this isn't about getting off your medicine. I think there's also a little bit of kind of a discrepancy in how people talk about it because, I like to look at it really holistically, but also in like a very scientific way, because there are people on the other side that are like, all medicine is bad. No one should ever be on medicine, and the goal is to get off thyroid medicine. I really don't agree with that, because what happens is with Hashimoto's destroys your thyroid. And so once the part of the thyroid is destroyed, there's not really a way to get it back. Can we get the thyroid to work better? Yes, absolutely. But parts of it may not be working. And so I myself am on a small dose of thyroid medicine. And I learned the hard way, because for the longest time, I was one of those people thinking everything natural is good. Everything medication is bad. It doesn't matter what medication is bad. That's it. Right. But it doesn't work that way. And so my TSH actually did start to climb up. It was about 20 years ago, maybe 18 years ago, something like that. And I was very stubborn. I'm going to do this naturally. I eat well. I do all the things. I'm not taking it. And I definitely felt way better than I did before, but I wasn't where I needed to be. And so once again, like I learned, I understood, because there's a lot of misconceptions out there. And I started a small dose of thyroid medicine. Literally, my world changed. My hair.
Oh yeah. Like putting glasses on your world.
Past my shoulders.
Yeah. No, I'm glad you're saying this, because remission sometimes just means that you're stabilized on this dosage and it doesn't keep going up and up.
Exactly.
And yeah, you're right. And it's not so much a medication. Like what I say about thyroid meds is the same as I say about BHRT, which is it's not really a medication. I'm putting back something that your body's no longer able to create, right? So it's not really, it's this like external mechanism. You need this. So
exactly. It's different than a cholesterol medication, let's say, or something like that.
Right.
Absolutely. And so going back to your question, when you were asking about, what would I do? What we're doing is we're looking at basically what are the things that are creating the immune system to become confused and to start to think that your thyroid is not your friend.
Yeah.
And think that the thyroid is an enemy, right? And those things are what I call thyroid triggers, or Hashimoto's triggers, I should say. And they're going to be different for different people, but typically they fall into 4 big categories. They fall into the category of toxins, the category of infections, the category of foods that maybe the body doesn't like, and the category of stress. And then within that, look at the things that are going to be specific to that individual, right? So when we look at infections, that could be things like Epstein-Barr, which we've seen so much reactivation of, especially post-COVID and COVID shots. And then we look at, other infections, potentially gut infections like Candida or H. pylori or parasites that are known to be triggers. Because what happens is that if you have an infection, and especially if it's more chronic, the immune system is going to continuously go after it, but then it gets tired out. And, I kind of make this analogy. It's like when a soldier goes to war and comes back with PTSD. It's the same idea. The immune system, then it gets tired, and then it just gets all confused and starts to react before it actually sees what's going on. And then, sorry, go ahead.
No, I want to ask you a question, because first of all, I love how you categorized it, right? I love that, because some people are like, oh, what, everyone has to go gluten-free? Although the answer to that is probably yes with Hashimoto. But there's more to it than that. So some people are just great just with nutrition, but some people also need to manage the infection or the toxins. So I love that you did that, because first, I'm sure at this point in your career, you know that the ones that are solved just in nutrition are few and far between at this point. There's always other layers.
Yeah.
But I wanted to ask you about Epstein-Barr for a second. I'm kind of off topic, but like, I always wonder about that, because parasites we're going to get rid of, Candida we're going to get rid of, but Epstein-Barr, like, what is your move there? Because it's kind of always there.
Yeah, absolutely. It is always there. And that's what I tell people, that like it's in your DNA, you'll never get rid of it, but we keep it down. We keep the viral load down. So I like to test to see if it has reactivated. And I've just seen that early antigen in so many people. And I speak a lot with Dr. Kasha Kynes. I don't know if you know who she is, but she is she's one of the main EBV experts in the country. She's amazing. And so I've done some of her programs and versed in some of her protocols. But, essentially what I like to do is, if someone is reactivated, then we do antivirals. And there's a specific protocol, which of course it's tweaked to the individual to bring it down. And usually, I do that for 4 to 6 weeks. And then we look at all of the other things. So why did it reactivate, right?
Yeah, that's what's going to
Actually,
actually.
was it stress, right? Was it something else? And so you know, because it's not like you're going to be doing antivirals forever and ever, though there are some people who continuously reactivate and we need to keep it down. But while we're doing that, we're looking at what's going on with their cortisol, what's going on with stress. And stress is such a big thing. And you know, it's interesting too. That's one thing that I really didn't address initially in my practice and with myself, because I was so like black and white, like this is tangible, like this, look, this test shows this, look, we're just going to take this vitamin to get rid of this or cleanse this out, right? But never realizing that like the body does have this ability to heal. But we talk about it all the time, right? But like actually seeing firsthand that like if we just bring our nervous system down, that's actually in control of everything else. And so, you know, once I get into meditation and all of that, like I think the whole
I think it's the evolution of many providers. I think many, like, we all, like when I first started, it was like test that. And then I was like, I don't really need all these tests. I started using the test when I hit a wall, you know, and then it's like, you know, move this lever and then move this lever, then move this lever. And then I think, you know, I also only got into this world of like I don't see patients anymore, but towards the end is when I started adding this piece to it. And I think there's an evolution because I think what you describe is so common. Like then we're like, okay, I know this part now and there's a pattern. But if I don't address this big stress, you know, and central nervous activation, none of it will get better. And I learned that with my most complex patients where we did every single thing right and they weren't getting better. I'm like, what is this? And I actually learned from my mold guru, Dr. Neil Nathan. And he was like, they're not going to get better unless you address this first. Like, don't even start the protocol on these patients. So it's funny that you said that you addressed it later on. So now do you start there? Do you start with managing that like right from the start?
I incorporate it into everything. I mean, I don't see very many patients anymore because most of my work now is through my courses and groups. But even with them, you know, this is ingrained into everything that I do. And we kind of start that while we'll do the other stuff. I think that what happens is there are people who understand the stress component, but I don't know if you agree with this, but a lot of people I find understand it, but don't care.
For sure.
Right. So they'll say like, yeah, I'm not really stressed, or yeah, I'm stressed, but it's not important. So it's like,
where's the multivitamin I could take?
Right. Exactly. Where's the cleanse I can do? So I fit it into everywhere, but not in a way that sometimes is very obvious. Yes, if that makes sense. You know, it's like we give people what they want.
That's true.
But really they're getting what they need as well. So
that's true.
They put it in creative ways, I guess.
Yeah. But I think with my most complex patients, it was a deal breaker. I was like, if we don't start here, we're never, I was setting myself up to fail. With the ones that are so sick that so many things are going on, at that point, the central nervous system is so activated that you're just going to climb an uphill battle. It took me a long time to realize that. So you weave it in. Okay. So you said that right now it's mostly group for you?
Yeah, I mean, I take on a few a year, one-on-one patients, and I have associates who work in my practice that do take patients people need. But yeah, it's mostly through courses, you know, like self-paced courses that have support and they could still get one-on-one as part of the course. And there's email support that my team provides as well.
That's great. That's amazing. And then in that support, do you still do testing?
So yes, right now we focus, I mean, for my main course, which is Thyroid Mystery Solved, and it's for people who have Hashimoto's, what I talk about is they need to be able to figure out what their thyroid type is and support their immune system at the same time. So that course has very specific explanations and what they need in terms of thyroid labs, because we really can't figure out someone's thyroid type if they don't have a full thyroid panel. So that's not just TSH. That's
what do you mean? What do you mean by type? Like, are they converters, or do you mean by that, or?
Yeah. So a thyroid type, you know, and these are types that I've kind of came up with that I see all the time, but they're essentially patterns. So yeah. So whether someone is not converting, or whether their hormones are not available to their cells, or whether it's that their pituitary may not be properly stimulating the thyroid. And, you know, and then also there is the type that I call it the all normal type Hashimoto's, which is what I had, right? Which is the normal, and not just the normal thyroid hormones, right? But antibodies and that really requires a very specific approach, and not just do nothing.
You mean for people with antibodies or without antibodies?
With antibodies.
Yeah, with antibodies.
So with antibodies, but normal TSH, normal hormones, because most people are told it's nothing, but I have it as its own type because there is so much that you do.
For sure. So you do that. So you have them do the labs, and based on the labs, like if this is high, if that is high, if this is happening, this is where you are. And then your protocol, of course, changes, right?
Exactly. Yeah. So basically what I try to do with this program is to kind of take my brain and how I would see people and put it into something where they can follow along.
Sure.
But it is very customized, because a one-size-fits-all approach does not fit into thyroid because people have different types. They have different triggers. But what was happening is my wait list got to be like 2 years. And like, okay, well, this is
not sustainable.
How is this even helping people anymore? I can't even get anyone in. And I was burnt out and exhausted.
100%.
But I also found that I was saying the same thing over and over again with different things. So it's like I just took my brain and put it into videos.
No, it's true. It's, to a certain extent with some issues, there are patterns. And so it makes sense on both sides. Like if you're going to be able to give some things that are just like one to many, it's more accessible to the client. I think it's great. And then if you really, after doing all this, still hit a wall, then you might need some additional customization. But most of the time, it's not the case. I agree with you.
Yeah. Well, and the customization is in there, right? Because the way that it works is they figure out what their type is, and then they have lessons specifically for that type.
Their type.
They're not listening to the other types. They're going just for their type. Yeah.
That's very helpful, because it's funny, right? Because we bundle Hashimoto's all into one, but even there are subtype, which is so really much great.
More. Yeah. Well, it's also more affordable, because that's the other thing. I mean, I had a really long wait list, but there were people who needed the information, needed the help, but they couldn't even get on the wait list because they couldn't afford it. And I really hate to price people out. So it's a way to, and I have other smaller programs that are like jump starts to get into that are really lower ticket. So there's something for everyone.
I love that. So, okay, so we do the category. We figure out our categories based on basic labs from Quest. We don't need anything, fancy for that, I imagine. Then we watch our videos. At what point do we start digging into like, well, what triggered it? Like if we're doing additional testing, or is that
no? Yeah. So so the way that we do the triggers is as people, and it depends on their type. So for some types, we need to start supporting the type. Like, for example, if someone is a high TSH type and they truly need thyroid hormone, right, then they work with their doctor, and we have very specific things that they can request and see so that they're getting that. So that comes first before any trigger, because if you don't have enough thyroid hormone, you can go cleanse your liver and you're going to get absolutely nowhere, right?
Whole day.
Yeah. So depending on the type, they'll support the thyroid first, then do triggers. In some cases, the thyroid type may not even really need support, because if once you do the triggers, that gets better too. And so then we go through the different triggers. So that we look at digestive stuff. So I have very specific quizzes and questionnaires to help them to figure what some of those triggers are. And then I also talk about labs that they can do optionally, because again, I want to make sure that people aren't spending thousands of dollars to then end up with the same information that we already knew. So we do different protocols based on quizzes that are also customized based on their results. And then, I offer extra optional testing if they want to learn more. For example, H. pylori is something that can be a big trigger, and there's not really a good questionnaire for it. I mean, you can do a questionnaire to see how much overgrowth there may be, but it's not going to be specific to, hey, do you have H. pylori? So then I recommend tests for, like, Doctor's Data does a nice test. I used to use GMAP, but I found that to be just a little bit more inconclusive these days. So I've been recommending other labs for them. So if they want to test and see if they have that. And then I have a protocol for H. pylori. But again, we don't do that unless they have that. And then I tell them the things for Epstein-Barr, where you want to test 4 different markers, and then show them based on if this is high versus this is high versus this is low. That's how you know. And then there's a protocol for that. And then we look at liver, and we support liver generally. But again, when it's generally based on how much toxicity they have, right? So there could be a medium support, a more moderate support. And then I talk about labs if we want, especially if someone has a history, right, of silver fillings like or, birth control pill, for example, that can increase copper in some people. So we can look at things like a hair test, or look at a red blood cell mercury test as well.
I love it. You developed quite the algorithm. I love it.
Yeah, it took me 2 hours. 2 hours. Oh my God, 2 years.
It was 2 hours. It was fine.
Great 2 years
No,
to get it all together.
yeah, just to be able to, like every bifurcation has a whole list. That's kudos to you. That's great. I haven't even seen it, and I think that's amazing. Oh my God. So what else do you want to tell our audience that maybe I didn't ask you yet?
Well, I think, oh gosh, so many things. Well, first, I think as we talk about thyroid stuff specifically, right? I think it's really important for people to understand that it's not like they did something wrong, because so often people said, oh, well, why did this happen to me? What did I do wrong? And how can I
Right.
prevent it? And, I think a lot of it is, I talk about this bucket analogy, right? Where we all have buckets in our body, and, we have stress that goes in the bucket. We're exposed to certain toxins that goes in the bucket. There are things that happen in our life, trauma, right? Other emotions that goes in the bucket, and eventually the bucket overflows. So, I mean, it's not your fault. Sometimes things happen, right? So it's really about saying, okay, well, what's in the bucket? And let's just start to look in there and start taking stuff out. And what's important to remember is that every little bit that you do is going to be helpful, and it's going to be effective. And it's not about taking every single thing out of the bucket.
Right.
People see with Hashimoto as well, can I only bring it to remission if I get rid of every single trigger? Not necessarily, because a lot of times if let's say you have 10 triggers, but you get rid of the 5 big ones, then your immune system is going to be lower, your nerve system is lower, the rest are going to go, right? So you don't have to be perfect. I mean, yes, there's work, right? Yes, we have to be specific. It's not just like, let's throw something at it and hope that something sticks, right? But your body, like, I just love this, I mean, it sounds cliche, like your body knows how to heal, but really, like, in all seriousness, your body does. You just have to get out of your way and help it in like a way that's going to be effective. So I think so many people try to like white knuckle it. It's like, but it's like if you're pushing so much, like you might be missing something, and I think you mentioned HRT before, and that's kind of another big thing. But I mean, I don't get into HRT specifically in my program, but I do talk about it because so many people that I see, and it sounds like that are your audience as well, are between about 45 and 65, right? And so then we get into the perimenopause. I mean, even the menopause. I think as we get into perimenopause, which really for most people is right around 41, that we start to see those changes. And some people's hormones go down, quicker than others, right? But if those hormones aren't optimized, you're also kind of trying to walk in ski boots.
Yep, uphill battle. You can do all of it. You said 2 really important things there I want to surface. One, it's not your fault. It's not your fault that you have this. It's like the cup runneth over, so look at many things. And because it's many things, you're right. You don't have to do all of them. And just bringing that water level down so it's not constantly overflowing is great. And so to your point, it's like, so you don't have to do everything. But I also want to say it's never going to be one thing either. Right. If people are like, if I just take this supplement and I just saw this liver clamp, it's never going to be one thing, because it took you many things to do this. It's going to take many things to bring it down. You don't have to do all of them. But we have to get out of this mindset of like, well, I don't want to take this medication, but instead I'm going to take this one supplement. We have to get out of that mindset, right?
I love that. Yes. And I can't tell you how often, I'm sure you've seen it so much too, people come to you, right, with a rattling bag of supplements.
Oh my God, yes.
I'm like, oh my gosh, like who gave you all this?
What is happening here?
This, and this doctor gave me that. And I'm like, literally, they threw the kitchen sink at you.
Yeah.
You're just
and not a selenium among them. Right? So, and like sometimes they're like, well, there's like 40 things here, and there's not one thing that you need for your particular issue, right? So it's really funny. So I mentioned selenium for those listeners because so many of our thyroid patients need that, and sometimes they don't even walk in with that. So from the 25 things, there's not even in that. That doesn't mean everyone needs selenium, by the way. Just putting it there. So thank you so much for being here. Any other last words for our audience?
I would say that if you're dealing with health issues, whether it's, issues with weight or brain fog or fatigue or anything else that comes with Hashimoto's or another autoimmune disease or any health concern, it's just really knowing that the answers are out there. Because so often people are like, well, I've tried this, it didn't work. It's probably because maybe you just haven't addressed it from the right angle or looked at it like from where like you need to look at it from, right? It doesn't mean that you're a lost cause. It doesn't mean like that's it, it's the end. Like there's always answers. And sometimes they're not so straightforward, right? It may not be like we said, this vitamin or this food. I think sometimes people, I mean, I love as a nutritionist, right? I love focusing on food, but I almost feel like people over focus sometimes and they take so many things out, right? And then they come to me and say, well, I can't eat these foods because I was sensitive to this, I took it out. I was sensitive to this, I took it out. Now I can only eat 10 things and that's it, right? Well, that's not good either because of the microbiome diversity and all of the other things, right? So I think it's, the answer is there. And sometimes it just requires looking from a different angle or seeing a different provider, and that's where some of the mindset stuff can really come in and can be a really big part in addition to all of the other things.
I love this. So get yourself a guide. It's not in your head, and get yourself a guide. And sounds like you should have Ina as your guide because it sounds like you really figure this out in a way that's accessible to many. Kudos to you for doing that. I know how much work that takes. So thank you for doing that for our audience. It's great. Thank you for being here.
Of course. Thank you so much for having me. I really appreciate it. Thank you for doing all the work that you do to spread all this information because it's really important.
Thank you. So anyone struggling with Hashimoto's, you take a look at these links and find Ina and get better.